Hello, this is Dr. Iman Beg from UAE. We have a very important topic today regarding heart diseases in cats and dogs. The first problem, which is commonly occurs in cats and dogs, is the saddle thrombus. What is the saddle thrombus? Saddle thrombus is due to the fate. What is fate? Feline aortic thromboembolism. This is commonly occur condition in cats as compared to dogs, and this will happen due to the many reasons, like some are the coagulation factors disturbances, some are the infectious diseases origin, and we will discuss some of these now. The first problem is the saddle thrombus. Saddle thrombus is due to the HCM. HCM is the hypertrophic cardiomyopathy. Due to the HCM, there are the some blood, there are coagulation between the heart. When the coagulated blood is reside into the heart, it's just moved toward the body from the larger artery, which is the aorta, is the largest artery in the body. After passing from the aorta to the other part of the body, it usually saddle or obstruct or entangle into the iliac artery. What is the iliac artery? Iliac artery is just supplying, it's the common iliac artery is supplying to the left and right leg. So the right leg, if the right leg is involved, then there are the signs which are appear on the cats and dogs regarding the species on the specific side of the leg. And how we can differentiate these infections from the other problems, and how we can get the definitive or confirmatory diagnosis. The introduction, like I have told you already, like there is a thrombus formation which is just inside the heart, or it can be coagulated, the coagulation or the thrombus any type of the body, or anywhere in the body. Any type of the thrombus, it can cause or obstruct in any part of the body, but usually what happen is the coagulated blood, it's the thrombus, it's just embolism or embolized into the iliac artery. In this case, you can obviously you will have very low blood pressure on the specific site. You will see the cyanotic area in the specific leg or the both legs, and the temperature in this case is lower. As the temperature is lower, the condition is more worse. The temperature through the rectal temperature we can check, and other signs which you can see on your patient is the cyanotic, the paw. You will see the if the fortunately you have a cat or the dog having a pink skin, you will see there is a very clear cyanotic area. In the dogs, they have hyperpigmented, or the melanin, they have good melanin pigments. So we check for other signs, like there is a cold and firm legs, and sometimes what happen is the cat cannot move their legs, and the legs will be the paralyzed. So it's also the common condition in the saddle thrombus in cats and dogs. It usually happen in the cats commonly, and other than that, cat like to panting more and salivating more and moaning and yawning, like it's crying just for the pains. Due to the pain, you must have to manage all the signs which you noticing in your patients. So after checking these clinical signs, you have to go for the lab diagnosis. The first lab diagnosis is the X-ray. You can get the chest X-ray. After taking the X-ray, you will see there are the bigger size or the smaller size of the heart. After checking the heart sizes or any anomaly, like you can see the heart murmurs in the X-ray when you conduct your chest X-ray, like the lateral and the api view. After conducting the X-ray, you will go for the ECG to check the functionality of the heart. Either the heart is performing good function or not performing a well function. So go for the ECG just to check the functionality of the heart. Other than that, you will definitely go for the CBC just to check the infectious, like if there is a infectious cause behind the thrombus or any other cause, or you can just check the anemia level in the CBC report, and you must have to check the other organs functionality through their tests like LFT, RFTs, and something like that. You have to check the coagulation factor. You will just take a blood from the patient and check the coagulation factor, either the coagulation time is increase or decrease. So these are the common sign and the tests through which we can differentiate the diagnosis of the fate. Like you will see your cat or the dog is just limping from the last day, and before that he is performing and walking, everything is well. You will have definitely have to contact your veterinarian for this problem. And if you see any abnormality, you must have to consult your vet. It's basically for the you can say the information for those who may concern. If we are talking about the treatment, prevention and control, for the saddle, we discussed the four abbreviations at the start. The first is the HCM, fate, and heartworms, and other conditions we can also check through the heart. Like there are many other conditions which through which we have to fix our diagnosis. Then we will go for the treatment of specific infection or the specific condition. The treatment for the treatment, control and prevention, like the heartworms, which is usually common in the USA, Canada and UK, you just go for the vaccination. There is the annual vaccination through which we can prevent the heartworms propagation. Heartworms usually it reside into the heart when but the larva can move to the lungs, and it will be increase in the size, and it can cause the death in the dogs and cats. Usually happen in dogs. The GST also involved in this condition. If you see any GST with the heart condition, you must have to consider the heartworms also. You can get the vaccination and you will be prevent this infection from your dog. Yeah, if we are talking about the saddle and the fate, feline aortic thromboembolism or the saddle thrombus in the cats and dogs, we will check these infections. We will treat these infections like usually I will do for the kinase drugs, which are the fibrolytic drugs. These are the drugs through which we can reduce the size of the thrombus in the specific site, but it usually not giving the good results, because every drug has its own side effects. These kinase group drugs, they can cause the nose bleeding because they are thinning the blood. They can cause the different hypersensitivity infection in your cats and dogs. And of course, it's very important to manage the shock in the cats and dogs, because due to the obstruction or the thrombus which is embolized into the part, it's reduced the chances of the fluid transfer to the body. So we have to manage the shock as well. And other than that, the pain management, which is very important, because the cat and dogs cannot bear this highly pain. So we have to manage the pain as well. There is a leech therapy which is very important and usually used in the advanced countries. Like we can use the leech therapy for the treatment of the thromboembolism in the cats and dogs. If we are failed to treat this infection and the cat and the dog is not surviving, feeling very good after the treatment or the diagnosis, so at the end we are very sorry for the treatment. Like we have to go for the euthanize. This is the whole story regarding the heart diseases in cats and dogs. I have to talk something like which is very important to all the pet owners as well as for the fresh graduates, through which they can understand like how the heart diseases can propagate into the dogs and cats, and how we can control and treat these infections. And if you have any question regarding the heart diseases in cats and dogs, you just put the comment. Inshallah, we will try to answer your questions. Thank you so much.